Hi, everyone. Welcome back to another episode of Ask a Professional. My name is Ryan Abramski, and I'm the Business Development Director for EasyLiving. We're a home care and care management agency serving the Tampa Bay area for over 20 years. Today, I am joined by Katie Conway. She is a Business Development Manager for Mobile Physician Services. Katie, thank you so much for joining us. Appreciate your time today.
Thank you, Ryan, for having me on.
Absolutely. So tell us a little about yourself and tell us a little about Mobile Physician Services.
So Mobile Physician Services, we're a medical house call practice. So we see patients at home, whether they live at home in an assisted living facility or in an independent living facility, we go to them. Our entire practice is house calls. We don't have an office where we see patients. We are 100% mobile. Dr. Waxman started the practice back in 2006 with about 10 patients, and we now have grown to over 25 counties in Florida and 5 counties in Ohio.
That's awesome. Yeah, and I think nowadays, especially with COVID, I think a lot more people are liking the idea of the mobile aspect of a doctor's practice, especially with mobile physician services too.
Absolutely. And there's actually a lot of physicians that have temporarily closed their office because they're not wanting their offices full of sick people. So we've gotten calls left and right with people that obviously still need medical care during this pandemic, and they have found us online or on Facebook, social media, and have called. And so we've actually been able to take on and help a lot of patients that would normally not have access to medical care right now.
Absolutely. And that's, especially with the seniors that we serve too, a lot of them either can't leave their homes or don't want to leave their homes. And it's great to have something like a service that you guys provide. So, speaking of doctors and making house calls, stuff like that, what you guys have any certain specialties or what type of doctors are available out there for people looking for this kind of service?
Yeah, so when we started, we just had primary care, but then we realized, well, if you can't get out to see your primary care physician, you're probably not getting out to see any type of physician. So we've kind of added as many specialties as we could over the last 14 plus years. Mm-hmm. We've added podiatry, optometry, psychiatry, pain management, palliative care, and wound care, all that are able to see the patient in home. So all of our diabetic patients get annual eye exams and annual feet exams. And then, we can also do the every 9-week nail trimmings and things of that sort. But we really want to bring as much as we can to the patient at home. If they need x-rays or ultrasound or an EKG, we can order those to be done in home. If they need labs done, urine, blood, things along those lines, we can order that. There's mobile labs that come into the home. We coordinate with home health, both on the nursing, the therapy side, the skilled, as well as the private duty. So if we see someone really needing help, maybe with some light housekeeping or companion care, things along those lines, we can definitely get those services in place as well.
Absolutely. And it's always amazing to me how incredible the level of care that can be provided in someone's home and basically out of a hospital, out of a doctor's office. I mean, with all those services that you guys mentioned, plus everything else you can order on top of it, it's just you really don't have to leave your house anymore. It's
absolutely
really amazing.
Yep. And as a physicians group, we really get a more complete picture of what's going on. Because when you go to your physician's office, you may get 10 or 15 minutes of their time in a lot of cases, but we're in there for 45 minutes to an hour. So we can see the living conditions, we can see the family dynamics, and that has a lot to do with the effect on our patient's health. So getting a more complete and accurate picture really helps us treat the patient.
Yeah, it's amazing. It's amazing how physicians basically started with people, decades and, generations ago, visiting people in their homes. Then it went to the practices, and now it almost seems like we're getting back to the homebound kind of doctor situation. So
yeah, it's come full circle.
Right. So, just to ask, everyone's asked about costs and insurances, what do you guys take for insurances?
So we accept Medicare. So traditional Medicare covers our services 80%, just like they would if you go to a physician's office. And then the remaining 20% we drop to the secondary insurance, and we accept any secondary insurance, whether it's TRICARE, Medicaid, Blue Cross, Humana, and then any of the PPO Advantage plans we can accept as well.
Okay, awesome. And then I know, again, kind of talking about the COVID-19 pandemic and stuff like that, some people don't want to go to doctors, and some people don't even want people in their homes. So is there anything else that you guys can offer to help someone that might not want anyone in their home on top of not going out to the doctors?
Yes, absolutely. Medicare has actually changed some of their guidelines. They now are paying for telemedicine visits. So if there's somebody in the home that has a smartphone, an iPad, a computer, a laptop, any type of device that has Wi-Fi, we actually use Zoom, and we can do a Zoom meeting with them. And 8 months ago, 9 months ago, a lot of our seniors didn't have a smartphone or had no idea how to access Zoom or any of that stuff. But now with COVID, that's the only way they're getting to see their grandkids. So our senior population is really, taking to technology, which has really helped us quite a bit. And then there's some assisted living facilities too that aren't wanting outside visitors. And in those cases, the employees of the assisted living facilities are really stepping up and helping their residents with their medical visits with us so that they can still get the care that they need.
Absolutely. Yeah, it's the pandemic, yes, it's a terrible thing, but it's also brought a lot of different and positive, I think, changes in this world. And we've adapted as humans do to making things work no matter what the struggle is. So Katie, I appreciate the information. So you guys do serve at least, I know you said 25 counties in Florida here, so that does include the Tampa Bay area, Pinellas, Pasco, Hillsborough, correct?
Yep, absolutely. A very rough guideline is Gainesville south.
Okay.
There's
Perfect.
A couple pockets we don't do, like Highlands and Hardee County. We're not quite there yet. But if you kind of take a line at Gainesville and go south, we pretty much can cover that whole area. And then the
Awesome.
Dayton, Ohio area as well.
Okay, great. Yeah, we have some snowbirds too and I know a big one is the Ohio area. So they definitely can assist with that too. So, but we'll put Katie's information and Mobile Physician Services information, their website and their phone number. So if you're interested in getting in contact with them, you'll have that information available right there. Or you can always reach out to us at EasyLiving, send us a message, post a comment down below, or reach out to us on our website, and we'll make sure you guys get in touch with Katie and the Mobile Physician Services group. So, Katie, thank you so much for all the information. I really appreciate that. It's great to know that you guys offer such a vast variety of services and different doctors and specialties out there for our homebound individuals.
Absolutely. Thank you so much for having me on today, Ryan. It's great to see everybody working together and thinking outside the box to take care of our seniors during these challenging times.
Absolutely. And I hope everyone has a good rest of the day, and we'll see everyone next week. Thank you so much.
Bye.